Now next is drugs used in Alzheimer's disease. Now Alzheimer has three distinguishing features, okay? Treatment is based on that. First is accumulation of senile plaques, beta amyloid accumulation. Second is formation of numerous neurofibrillary tangles. And the third is loss of cortical neurons, particularly cholinergic neurons. So the therapy will aim to improve its cholinergic transmission within the CNS and prevent the excitotoxic actions, which will result from overstimulation of NMDA glutamate receptors. And the care is modest short-term benefit and only palliative. They are not giving therapy to neurodegenerative disorders. Now the first type of drug is acetylcholinesterase inhibitors, enzyme inhibitors. They are linked with the progressive loss of cholinergic neurons, and they will improve the cholinergic transmission when they will inhibit the enzyme. The reversible inhibitors, they are approved and are donepezil, galantamine, rivastigmine. So they have some selectivity for acetylcholinesterase in the CNS as compared to the rest of the periphery. The first one, galantamine, this will also augment the action of acetylcholine at nicotinic receptors. So these may provide modest reduction in the rate of loss of cognitive function in the Alzheimer patients. Next is rivastigmine. This is the only agent which is approved for the management of dementia which is associated with Alzheimer and Parkinson disease. So they are also available as transdermal patch. This is the only drug, rivastigmine. Rivastigmine is hydrolyzed to carbamylated metabolite. No interaction with the drugs. The agents or substrate for cytochrome P450 have a potential interactions. So the adverse effects are nausea, diarrhea, vomiting, anorexia, tremors, bradycardia, and muscle cramps. You can have a look. Tremors, bradycardia, especially with this, nausea, diarrhea, anorexia, and myalgia also, especially with these acetylcholinesterase inhibitors. Now NMDA receptor antagonist, stimulation of glutamate receptors in the CNS is critical for the formation of certain memories. When it is overstimulated, it will result in excitotoxic effects. So the suggested mechanism for neurodegenerative or apoptotic processes. When glutamate is binded to the NMDA receptors, it will open an ion channel which will allow the calcium ions to enter the neuron. Now excessive entrance of calcium ion will activate a number of processes and ultimately it will lead to apoptosis. The first drug, mementamine, which is an NMDA receptor antagonist, is indicated for moderate to severe Alzheimer's disease. It acts by blocking this receptor and limiting calcium influx. Mementamine is well tolerated. Adverse effects include confusion, agitation, restlessness, and these NMDA receptor antagonists are often given in combination with the enzyme inhibitors, acetylcholinesterase inhibitors. Now the drugs used in multiple sclerosis. It is an autoimmune inflammatory demyelinating disease in the CNS, and it may consist of 1 or 2 acute neurologic episodes. It is chronic, relapsing, and progressive disease. And historically, corticosteroids are used here, dexamethasone or prednisone. The chemotherapeutic agents are cyclophosphamide and azathioprine for this. Now the therapy aims at disease modifying, and the drugs here which are used are interferon, beta 1 alpha. Next is glatiramir, fingolimod, teriflunomide, dimethyl fumarate, and monoclonal antibodies. First, interferon, we'll see these. The effect, they help to diminish the inflammatory response, which will lead to demyelination of the axon sheets, and adverse effects are depression, local site injections, and they will increase the enzymes and flu-like symptoms. Gladiramir is a synthetic polypeptide. It resembles to myelin protein, and it acts as a decoy to T cell death. It also has flushing, chest pain, anxiety, itching. Fingolimod, oral drug. Fewer lymphocytes in the CNS. It has bradycardia and risk of infection. Teriflunomide, it is also oral, and it is contraindicated in pregnancy. Dimethyl fumarate, flushing, abdominal pain are the common. Monoclonal antibodies such as alemtuzumab, daclizumab, natalizumab, and ocrelizumab. These are used for multiple sclerosis. These are associated with significant toxicities, and these are only used when the other therapies are not working. And we usually give symptomatic treatment to manage spasticity, constipation, bladder dysfunction, and depression. Dalfampyridine is oral potassium channel blocker, and it improves walking speeds in patient. Now, drugs used in amyotrophic